Welcome to Rom Wills Money Matters. Always opportunities in the healthcare industry. Always opportunities in the healthcare industry. You know what? I was thinking about that because I had talked last week about, the nursing shortage briefly. I touched on it. And I was thinking about that, and I was actually going to talk more about it, but then I thought about the overall healthcare industry. There's nothing but opportunity. Nothing but opportunity. And it's more than just nursing or doctors. It's so many things that could be done just related just to healthcare. Because even, since being in the hospital and everything, one of the things I've paid attention to was a lot of these commercials that they have on for different medicines. Think about Big Pharma is directly connected to the healthcare industry. That's just one thing. And then you're talking about pharmacists. You're talking about different little medical spots, everything, hospitals. In Harford County, they just opened up a new hospital, closed another one, but in my view and the view of some other people talking, they still need another one. So, that's still construction. There's a lot of primary things with the healthcare industry, and then secondary things, even tertiary things, everything connected all to health care. You talking about when I came out the hospital, I had a couple of walkers. I'm thinking, okay, somebody had to build those walkers, and then you got medical insurance. There's so much. If you look at it, there's so much you can do just connected to healthcare, and there's always opportunities in there, even if because this sounds jacked up to say it like this, but it's the truth. People always get sick. There's always going to be somebody getting sick. Always going to be somebody getting sick. And then you get a lot of people, they make their money preventing the sickness. Coming up with products or modalities to prevent the sickness. Indeed, people could argue that, exercise, I'm known for body game, just going in the gym, exercising and everything. In fact, I've been recommending that. Because I said, working out the way I did mitigated what could have been worse for me when I had the stroke. So that's the thing. But there's an opportunity there. And there's so much. If you want to make money, if you look at the GDP, a significant amount of it is, I think it was 10% of the gross domestic product is dealing with healthcare, and it's so much there. I know a beautiful young lady who she sells scrubs. That's connected to the healthcare industry. There's so many angles in it. I can't even think of them all because I don't work in the healthcare industry. I don't work in it. So imagine the people who work in it. It's obvious. Like I said, the doctors and nurses, and I'm gonna tell you what. Let me hit on that because I was gonna talk about that the entire video at first anyway. There's so many opportunities there. Like when I was in the hospital, I was listening to the nurses talk, and I was paying attention to their service. Yeah, they were worked to death. Both in the hospital and the therapy place, they didn't have enough nurses. And then they had to, like at the therapy place, they were bringing in some nursing agencies. They had to ask me, hey, what is it that what you got to take? What medicines you got to take? What we got to do? I had to stay on them about some stuff, but I was like, man, there's so many openings, and trust me, they wanted to get paid. And then, if you're talking about nursing, as you have since in my last episode, I was talking about regular retirement is a thing in the past. A lot of older people have to work, but a lot of older people also need help. And shoot, that's a tertiary industry just going around doing stuff for them. Not even healthcare connected. When you talk about stuff like DoorDash and everything, people buying for seniors because they can't do for self. So you got so much. There's so much to make money with because a lot of people will say, well, what can I do to make money? Let me use the nursing thing again. There's a lot of businesses that make their money with home nurses. Like a young lady I was dealing with a few years ago. That's how she made her money. I call her up. She's sitting at some old guy's house, just chilling. Doing stuff. I've seen that. Or people helping out around the house. Like, thankfully, I didn't really need that when I came out the hospital, but it was offered to me. It was offered. It was like, hey, you got somebody come there? I was like, no, I'm good. But it's still offered. But that's still a money thing. That's still something that had to be paid for, So that's an opportunity. And, especially with the homemades and stuff, a lot of times they don't have to have major training. That's the beauty of it, Sometimes somebody could offer something. I don't know. There's so much. Somebody could offer like a treasury business related to healthcare. Somebody who just simply, they don't do any healthcare themselves, but they say, well, we'll offer to clean some seniors' homes because they can't because of their health condition. It's so much there when you're thinking about a business. Now, only thing I would say is you have to have a stomach for it, depending on what you're doing. Like getting back to the nursing thing, one of the issues with the nurses, and I've seen this, I've witnessed this, patients could give them hell. I've known a few former nurses, they were just like, it ain't worth it. It take a lot. That's probably why they having some shortages now, because it takes a lot to really deal with them. So, but always opportunity, always. And I'm going to tell you what, when you think about business in general, not just healthcare, but just business in general, it's about what does the public need? Healthcare will always be there because, like I said, people are always getting sick. They either getting sick or they need to do something to prevent sickness. One or the other, one or the other. If you have a business, either prevention, that can go a long way, or to address it. Like I said, you can always make that money. Ambulance drivers, you got some businesses. I've seen some businesses or read about some businesses starting up, and all they doing is driving an ambulance. And trust me, oh man, they make a lot of money. They make a lot, just the ambulance. They make a lot of money. Or transport. They not even directly like going to maybe houses, but maybe just transporting people from like maybe their home to a doctor's appointment, something like that. There's so many. I mean, I'm quite sure if I were to sit down, could probably do a whole channel talking about all the businesses just related, primary businesses, secondary businesses, the tertiary businesses, just related just to healthcare. But there's always opportunities. If you're looking for a job, you're looking for business, things of that nature, that's some place to always look. I mean, there's just so much. I mean, shoot. Massages. Hey. Because I was, before the stroke, getting medical massages. I got to start that back up soon. But not the happy ending massages, but just, de-stressing the body. That was more preventive. So there's so much there. This is something to always look into, all right? So anyway, that's all I have for today. I want y'all to really think about that industry. And if it's not you, it's just not you. But there's a lot of opportunity there for those who might be open to doing something in that industry. All right? So y'all know the deal. Let's go make that money.